Navigating a recovery journey through mental health and substance use environments is often an erratic, highly nonlinear process. The clinical problem is that psychological recovery is a highly subjective experience. Because it varies so significantly between individuals, it resists standard quantification. Traditional medical models rely on a deficit-based approach, focusing on the reduction of negative symptoms. This method often fails to capture the nuances of human progress. Accurate mapping requires a strengths-based framework, a system designed to identify and document the accumulation of positive psychological and social resources. Mary Leamy and colleagues conceptualized a systematic solution to this mapping problem. Their solution, the CHIME Framework, provides a visual architecture for understanding processes that sustain a recovery journey. The model operationalizes personal recovery into 5 measurable, interdependent variables. To utilize this model, practitioners shift their focus toward building these 5 structural pillars within the patient's environment. The first foundational pillar is connectedness. Psychological recovery cannot be sustained in a social vacuum. This node requires establishing peer support systems and consistent relationships within structured support groups. Beyond this, the framework tracks active participation and reintegration into the wider community. The second pillar is hope and optimism about the future. Hope functions as the psychological baseline required to initiate change. It involves instilling a conviction that recovery is an attainable goal. Once this belief is established, it generates the motivation necessary to maintain change. While connectedness provides the external structure for recovery, hope provides the internal cognitive drive to begin the process. The third pillar is identity. Patients frequently experience a profound erosion of self-perception as a diagnosis begins to dominate their life. Practitioners must help navigate the dimensions of identity existing outside of pathology. The goal is to define and reinforce a positive sense of self. The fourth pillar is finding meaning. This requires a transition from basic survival toward a purposeful daily existence. Internally, this involves exploring spirituality and quality of life. Externally, the patient engages in meaningful activities and social roles to rebuild a functional life structure. Identity and meaning return the focus to the individual's social roles and internal self-perception, addressing the multidimensional life that pathology often obscures. The final pillar is empowerment. It acts as the operational engine driving the other components. This starts with the intentional assumption of personal responsibility. From there, the patient exerts conscious control over their life trajectory, sustained by a consistent focus on strengths over clinical deficits. Empowerment provides the agency required to maintain the first 4 pillars. It is the mechanism that converts the framework structure into a series of directed personal actions. Together, connectedness, hope, identity, meaning, and empowerment form the CHIME Framework. These 5 components comprise an integrated, interdependent psychological system. CHIME functions as a dynamic roadmap, used to guide specific, evolving interventions throughout the recovery timeline. In practice, this framework is utilized daily within mental health and substance use environments. Practitioners are encouraged to integrate this framework directly into their recovery learning programs. This involves a collaborative effort between practitioners and patients to identify specific, personalized bullet points for each of these 5 headings. Applying this multidimensional architecture allows for the systematic operationalization of recovery for every unique journey.